Hey, Dr. Erickson here again. I want to cover with you today something that I find very important. You need to know this information. This information is actually relating to chronic illness. Many people who are suffering from different types of chronic illnesses, believe it or not, actually suffer from some very common origins and very common links to the chronic issues that are being dealt with. I want you to look at this list here on this slide that I'm presenting to you. The conditions are on the left-hand side. Look at the different problems. We had a thyroid problem, vertigo, dizziness, and balance, chronic fatigue syndrome, peripheral neuropathy, migraine headaches, fibromyalgia, sciatica, irritable bowel problems, digestive disorders, insomnia, chronic neck pain, or stenosis. You know, perhaps you fall into one of these categories here, but here's what I find. With every one of these different conditions, I find there's some common grounds, meaning there's some common findings of things that are happening. Oxygen deficit, not getting enough oxygen to the body. Neurological misfiring, brain's not communicating like it's supposed to. Metabolic imbalances. Blood sugar problems is a big one. Anemias, cortisol problems, sensitivities, hormonal imbalances, autoimmune attacks, or brain imbalances. Now, if we break down those findings, they actually fall down into two different categories. The categories are both metabolic and neurological. Look at this next slide. Metabolic imbalances fall into the metabolic, blood sugar problems, anemias, cortisol problems, sensitivities, hormonal disorders and imbalances, autoimmune attacks, cholesterol, bacteria and parasitic infestations or infections. On the neurological side, we have the oxygen deficit, neurological misfiring, brain imbalances, loss of balance, brain fog, altered pain sensation, loss of sensation, blood sugar, and digestive issues. Yes, they can actually be tied in neurologically. In this last slide I want you to look at here, we're talking about the components. This breaks down, most of these chronic issues break down into these two different categories. Metabolic is about 40% of the problem, neurologic is about 60% of the problem. If you have not been evaluated neurologically and metabolically, you are missing very big pieces to the puzzle, and you're missing the ability to solve and help your chronic health issue. Come to the office where we actually can help you by addressing both of these components. If you do not address both the metabolic and the neurological side, it's like trying to run a foot race with only one leg. You need both of them done, you need them done right. Dr. John Erickson here saying, have a great day.